and chair of the Education and Training Committee of the Renal Pathology Society. I'm glad to launch this year's new RPS GLOMCOM Renal Pathology webinar series. Its first half focus on the many applications of computational pathology and AI to renal pathology. The speaker of our first webinar is a renal pathologist known to many of you and the former president of the RPS. It is Dr. Laura Barisoni.
Thank you, Nicolas, and thank you for inviting me. You can see my screen now. Thank you for inviting me to give this lecture, and thanks to all the people who are on Sunday morning logged in. So I'm trying to, so let me move this here. Okay, so you see my presentation screen, right? Okay.
Yes.
So computational pathology, minimal change disease, and FSGS, this is my disclosure. If you think about historically what we have done, we use morphology to classify diseases. So in the case of minimal change disease and FSGS, if we don't have lesion of segmental sclerosis, we call it minimal change disease. If we have lesion of segmental sclerosis, people came up with an algorithm to classify patients based on location and appearance of the lesion of sclerosis. And that the idea was to use this approach to define, to identify good versus bad prognostic characteristics. More recently, others have suggested that we should use primary, secondary versus reactive injury. The problem with this classification of the etiology classification, which is obviously a good idea, is that currently we do not have all, and we don't use especially all the tools that we would need to really classify these patients. So if we call patients, for example, secondary to what, or primary, did we really tested everything we can to exclude all secondary causes before we can say that something is primary, or that something is secondary, for example, to a permeability factor, because we don't have a test available to identify the permeability factors. So the way we classify patient is very limited. If we use morphologic classification, also, we have to keep in mind that within the same biopsy, there is an extreme heterogeneity of how glomeruli present. Not only that, but it's not all about the glomeruli. The glomeruli is just one compartment of the kidney, but we also know that the amount of interstitial fibrosis and tubular atrophy, the amount of arteriosclerosis, those are all the inflammation, those are all important elements that can modulate response to therapy and can modulate progression. So if we think about the modern approach to healthcare, we know that the clinical phenotype is the result of multiple events. It's the result of genetic variation, epigenetic modulation, transcriptional regulation, protein function, metabolite levels, and so on. And obviously what is happening in the kidney. So we need a multi-level analysis to really define the clinical phenotype, because the morphology alone is not enough, or the clinical alone is not enough. And so we need to think about how we can implement new approaches to study glomerular diseases, and starting us as pathology by changing the paradigms in pathology. From, currently we have used a one-size-fits-all approach. Pathologists create disease categories based on few pre-selected features, because we manually pre-select this handful of features, and then we test them against outcome. But really, we need to use an approach that is more integrated and take into account the individual variability, and use unsupervised learning and multi-axial data sets to define categories of patients that have similar biological trajectory, because that is what is important, is the biological trajectory, not much what it looks like in a way, not only. So we can better predict outcome and identify target of therapeutic intervention. So computational pathology is a science that really helps us to do all this. It's an approach to clinical research of patient care that uses multiple sources of raw data, clinical laboratory imaging, omics, extract biologically and clinically relevant information from these high-dimensional data, and uses mathematical models to generate